Welcome, and thank you for joining the conversation around COVID-19 and our children under 12. My name is Peter Chang, and I'll be your moderator this evening. I'm a hospitalist at TGH, and my official title is VP of Care Transition, and I run our Clinical Command Center. The following 45 minutes will address the questions you submitted around COVID-19 and our children. I'd like to give a special shout out and thanks to our community partner, More Health Incorporated, where they are leading the health in nation in health and safety. It's been with their support and advice that the idea of this virtual lecture came about, and without their efforts, it would not be possible today. So we really want to thank them for allowing us to share this content with you and share our experts with you. The general remarks I have around COVID are interesting. As a hospitalist at Tampa General, we've seen the devastating impact COVID-19 has had on our patients, our families, and our team members. We're lucky to say that I think we're at the end of the current surge that we're experiencing right now. And we would really like to hear from our experts. As an adult doctor, I don't often get to treat children outside of my medical school education. And I'm really looking forward to hearing from our experts and from both the medical side and also the mental health side. I think that's something that's very important that maybe we haven't paid as close attention to as the medical side of things, but has a huge impact on our lives every day. So this evening, I'm joined by Dr. Claudia Espinosa. She is a pediatric infectious disease specialist here at TGH with the University of South Florida Morsani College of Medicine. She's an associate professor there. Her research interests includes perinatal and congenital infections, hepatitis, and vaccine development. Most recently, she was involved with the management of the COVID-19 cases in pediatrics. She holds a clinic to evaluate children with COVID and the complications such as the long COVID syndrome, which we'll talk about later today. She's also been a sub-investigator in multiple clinical trials, including the COVID-19 vaccine trials. She currently is board certified in both pediatrics and infectious disease and holds various memberships in medical associations, including the American Academy of Pediatrics, the Pediatric Infectious Disease Society, the Infectious Society of America, and the Society for Healthcare and Epidemiology of America. Our second guest tonight is a pediatric clinical psychologist, and it's Dr. Nicole Williamson. Dr. Williamson holds a PhD in clinical psychology, specializing in children and families. Her professional interests include helping children and their families adjust to new medical diagnoses, engaging in promotion of behaviors and resiliency to reduce anxiety, depression, or social withdrawal associated with medical conditions or environmental factors. Over the past 2 weeks, we've received over 200 questions from you and our community. We'll do our best to make sure we address the main points from the questions you submitted, but unfortunately, we'll not be able to get to all of our questions. We urge you to seek the advice of our trusted medical specialists, such as your primary care doctor, or trusted resources like the Center for Disease Control, the Florida Department of Health, and from medical forums such as the one you're about to hear from. You can also visit tgh.org on the web to seek TGH Coronavirus Hub and the videos and articles from our medical experts addressing local updates and questions around vaccines. Many of the questions that were submitted over the last few weeks fall into 6 categories. The prevention measures on how we could prevent COVID-19 from spreading, the virus's impact and effect on our youth, the Delta variant, the treatments for COVID-19, and most importantly, the mental health and vaccination questions around COVID-19. So we'll try to touch on these subjects as best as we can and hopefully get through it with some good knowledge and some great points to take home and talk to our kids about. As a brief disclaimer, the information that you're about to hear is continuing to evolve, and what is being shared today is what we know as of this point in time from what our science tells us. We concentrate on our best practices to make sure that we're providing the highest level of care to everyone. And although we're talking with our medical experts, please always consult with your primary care provider or your pediatrician for individualized medical advice. So let's get started and tackle some of these tough questions that you guys submitted this evening. We'll start off with Dr. Espinosa. These questions are around COVID-19 and the impact to our children 12 and under. So the first question we have, Dr. Espinosa, is how common is it that children are getting COVID-19?
Dr. Chang, yes. From the first studies that we received back last year, it was clear that kids were not affected in the same way that adults did. The hospitalization rates at that point were really low for children, about 1%, but things have changed dramatically over the past actually few weeks and few months. And if we can share my screen, maybe I can show people what is going on with the hospitalization in children in Florida right now. And I'm gonna try to do that really quick. I hope that this work. Um, can everybody see that picture?
We can't see your screen, Dr. Espinosa.
No?
We can.
Okay, great. So the first line, the yellow line, is looking at the number of cases in Florida. So here we are, the first peak is from July 2020. And we can see that, there was a peak, but it wasn't as big as how we see it in January, right after the holidays. We saw a big increase. And then also nothing compared with what we have seen in the past few weeks. And I just want to point out that the last curve, the blue one, is showing the hospitalization. So the hospitalization rates are increasing in the same way that the cases are increasing. So the more cases that we have, the more chances that kids are going to end up in the hospital. At some point, we believe that maybe it was something related to the variants, but we really haven't proved that. The only thing that we are sure is that the more cases, more kids are going to end up in the hospital. So obviously, if you compare these numbers with the adults, then they are going to win. They have a lot more in hospitalizations, but nonetheless, these curves are really worrisome because it definitely shows how the strain in the healthcare system, a lot of beds were occupied. We have really for the past few weeks to make a lot of adjustments to be able to see all those kids. And these kids were in the ICUs and they were getting sick, and we have still some in the hospital, just like the adults do. So I just want to point out that even though you see in the news that kids don't get sick, well, that's not exactly true. And that everything depends on what we are doing in the community. Community rates are going up, then kids are more infected. Vaccination is not good, then kids are going to be infected more.
Great. Thank you so much, Dr. Espinosa. And as we look, you talked about some of the hospitalizations that we're seeing in our area hospitals, including Tampa General. Tell us a little bit more about what type of kids that you're seeing in regards to maybe some other medical conditions that they may have that would make their chances of getting hospitalized higher.
Yes, definitely. If a patient, a child has an underlying condition, right? They are immunosuppressed, they are in chemotherapy, they are diabetics. They are gonna have a higher risk of being in the hospital when they have COVID. It's not a direct relationship, right? It's not that all the kids that are in chemotherapy are going to end up in the hospital. We really don't know which ones are going to be. Now, we did see fair amount of kids that did not have absolutely any risk factors, and that was really worrisome too, because even kids that did not have absolutely any underlying conditions, they will end up in the hospital too. One problem that I want to make the community really aware of is obesity. So we are all worried about obesity in general, but COVID has impacted really in a huge way teenagers, especially in children who are obese. So they have a higher risk of being in the hospital and a higher risk of having complications due to COVID.
Great. Thank you so much for sharing some of that. I know we see all the news stories, but it really helps to hear from the doctors that are treating our patients and our children in hospitals to tell us, who's at risk and how we can further learn tonight, how we can protect them. There's been so many different discussions around testing. I think even my own kids at school around if there's an exposure, do you test if there's an exposure or whether my kid's symptomatic? So that's kind of the first part of the question. The second part is after they start to develop symptoms, how soon do I have to test?
Yes, Dr. Chang, that had changed and evolved over the course of the past months. And part of it is because we at the beginning we didn't really know a lot about this disease, and now we have learned to know it much more. And so things have changed, and I anticipate they are continue to change. And now some of the decisions that have been taken, they are not really based in scientific evidence. From the scientific evidence, we can conclude that after 9 days, probably the virus, even if it is in the nose, is not going to be infective. So that means that after 10 days, probably of a patient or a child being infected, they are not going to be more contagious if they are completely healthy. If they are immunosuppressed, that's another story. So that will be part of the question, when should we test, right? So to minimize the amount of days, because I'm sure Dr. Williamson is going to talk to us about how important it is for these kids to go back to school, then one of the measurements that had been taken is to test them at the day 6 or 7. And if at that time the test is negative, then maybe they can save some days of quarantine. And that is pretty well established. We have done it in the healthcare workers too. You remember those times too. One of the problems with kids is that most of them are not able to get vaccines right yet, and so they are gonna fall under another category. They are gonna be more at risk to get infected if they are a contact. One of the things that the community needs to remember is what a contact is, right? You are a contact if you were more than 15 minutes less than 6 feet apart from someone that has the infection. Now we reduce the impact of that contact if you have your mask on and the other person have their mask on. So if any of those factors are not counted, then probably we are going to have a higher risk. So when you ask me which patients should be tested or which child should be tested, well, definitely the first category is if your child has any symptoms. COVID may look very benign in many kids, and that's part of the problem, and that's what this disease has spread so easily because of that. So, but any symptom should be tested because COVID can look like any other virus in the community. So I suggest testing is easier now than it was last year. So hopefully people are taking advantage of that. And then the other patients or the other children that should be tested are those that are a contact, because you don't want to send your kid back to school when they are infected and asymptomatic, right? That in that cases you will be not doing good for the rest of the community that your child is, for the rest of the classroom. They spent a lot of time in the classroom, and those are indoor. Some of the classrooms may not have a lot of ventilation, so that's a problem too. And they are together; they are really closer, and even closer than 6 feet apart, because all the logistics that implies in the schools. So children who have any symptoms should be tested, and those who are a contact, considering what a contact is, should also be tested before returning to school.
Great. Thank you so much for the information. And this one is probably a little bit more of a personal question, but I have a second grader and a fifth grader, and my second grader woke up with a sore throat, was a little bit warm. So immediately I brought him in to get tested. And most importantly, I left my fifth grader at home, right? Because if he was symptomatic, I didn't want the other one to go to school. So That's another key point that you got to keep your kids together, especially if one of them is symptomatic, because the other one may be completely asymptomatic. And I took them in to get tested, negative for COVID, but positive for para-influenza 2, which is the virus that causes croup. Can you tell us maybe a little bit more as we're approaching the flu season, what you think is kind of going to happen? Because, as masks maybe aren't as prevalent, the other respiratory viruses away from COVID, we're starting to see more of them in kids. It's sort of the question. What are we seeing in regards to the non-COVID upper respiratory viruses?
Absolutely. Well, first of all, let me congratulate you because you are a good citizen and you did exactly the right thing, keeping your children at home. And yes, so we have seen that even from the past 6 months, probably the more we open schools, daycares, and the less than masks are being used in community places, the more viruses that are circulating in the community. I have a theory that is nowhere to be proved. It's going to be really hard. But, the same we see with kids, like, for example, when they start going to daycare, right? First year, if you remember your kids in daycare, it was terrible. They get sick a lot. And then they don't get that much sick because they get immunity and they get infections and then they create antibodies, which is the healthy thing to happen. For the past 18 months we kept these kids really isolated, right? Not a lot of interaction with other ones, so there were not a lot of viruses circulating in the community. Now we are opening everything, there are no masks in many places, and so that will contribute that a lot of more viruses are going to be circulating. So you bring another good point that anyway I wanted to say later on, which is the importance of getting the vaccination for the things that we can prevent. Flu shots are had been used for the longest time, right? From 6 months older, all children should get flu shot every year, every season, because there are different strains and we want to keep protected the kids and keep their immune system up to speed with the new variants that are coming. We don't want another pandemic coming on. So I will suggest that everybody gets the flu shot before the season starts, because we are probably gonna see a lot more than last year for sure, flu and other viruses circulating in the community.
Great. Thank you so much. Before we move on to Dr. Williamson, one last question, and I know it's a popular one because you hear so much about it in the media and in the news. It's really around this MIS-C phenomenon that we're seeing in kids. Can you tell us a little bit more? What does it mean? What happens to our kids that have it, and how are they recovering after they have it?
Yes, that is, one of the things that we had been perplexed about this virus and how different can affect children in, you know, children who have underlying conditions and those that are completely healthy. I actually have seen more MIS-C in kids that are completely healthy. Most of the kids that I see, they don't even know, the parents didn't even know that they have infection. The only way that we know that for sure they had it is because they have those antibodies against the virus. It occurs about 3 to 8 weeks after the child has COVID. And it is a very interesting condition. It's scary for many children. It's scary for many parents. It will, in many cases, about 60% of the patients that are hospitalized will end up in the ICU. It will compromise the most important organs like the neurologic system, the cardiovascular system, and also other ones like skin and kidney. So it's a disease, a condition that we really, really respect. We have learned to respect now recently. One thing that I want parents to remember is that if your child had COVID or was exposed to COVID but did not have a lot of symptoms, but now he is all of a sudden 3 to 8 weeks later showing fevers, right? Then just remember about this, be advocate for your child, keep going to the, in many cases, what I have seen is that they go to the pediatrician, they test it, it's negative for COVID, so they say it's a virus, right? And that's what most of the cases in kids, the fevers are because of viruses. But in this case, that's not a virus. And the longer than you start the treatment, the more complicated or more sequela that you can have. I have to say that we have seen deaths in reported because of this condition, and most of the deaths actually with COVID are because of multisystemic inflammatory syndrome. Thanks God we haven't seen any in Tampa General, um, but it's a scary condition, and parents should be aware of that, because it's important to seek medical attention as soon as possible.
Great, thank you. That was really, really informative and really helps us. And most importantly, making sure our parents know that if there was the remote possibility of their kids being infected with COVID, kind of keeping that 3 to 8 week time frame for the representation of symptoms with fever and aches and not doing well. And most importantly, the earlier we get your children to medical treatment, the better the outcomes are. So very, very important point. And thank you so much for everything you've done for our kids in our community. And still more to come on vaccines later on, but let's pass it over to Dr. Williamson. One of the questions we received were, I know my kids were basically homeschooled for a year from last year, and I always had a little anxiety myself on sending them back and not knowing how they were going to adjust from being behind a computer all day. So, what can we do to help decrease the anxiety for our kids as we're sending them back to these social settings in large groups, whether it be after school curricular activities or school itself?
Yeah, absolutely. That is one of the most common things that I'm seeing in terms of that increased anxiety about going back to school. And now that we're a number of weeks back into school, for many kids, that thankfully is going down, but still ongoing for some other kids as well. I think there's a number of things that families can do and parents can do to help kids to be able to cope with that. So one of the things that I really talk to families about is just helping kids, especially in this younger age range that we're talking about here today, really understand the signs of anxiety and understand oftentimes those physiological symptoms that are indicative of anxiety. So for example, if their stomachs are hurting a little bit, if they're feeling sweaty, if they're noticing they're really tense, helping them to be able to recognize that actually means you're nervous. That means you're worried. That's anxiety. And allowing them to have a label for that for many kids is something that they may not naturally do unless we kind of help to be able to coach them through that. So that's something that we can do as parents. Along those same lines, as you mentioned, Dr. Chang, that, help them recognize that anxiety is a really common experience, that they're not alone with that it's very likely that a number of their peers, their friends are feeling the same way. And that, for many parents that there was that experience as well with kids going back to school or returning back to work or being back more in the community, that they're not alone. And that feeling, that sense that they're not alone can make kids both feel more comforted and also help them be more likely to be able to talk about their experience. So helping them understand the signs of anxiety, normalizing it for them, recognizing they're not alone, and then thinking together, what are some things we can do when you're starting to feel that anxiety? For example, if you're going into school or if you're going into practice after school and you're noticing some of those symptoms, making a plan in terms of some coping strategies that they can use and experiment with and see how it helps with their anxiety. But a few kind of common coping strategies that I might go through with kids would be the idea of belly breathing. So helping them really take a deep breath. It's a little bit different than just a traditional deep breath. With belly breathing, you really want to think about getting air into our lungs and then all the way down to our stomachs. With younger kids, so more on that closer to like 5, 6, 7 age range, I'll even have them lay down on a couch, for example, or have them practice at home, laying on their beds, and have them put a stuffed animal on their bellies. And they want to see the stuffed animal go up and go down. And that way they know they're getting air all the way down into their bellies, because physiologically it has a calming effect on our bodies. And so it's different than just a deep breath and more effective. And another strategy that you could talk to kids about is this idea. It's a grounding strategy, so helping us feel more present in the moment, not thinking as much about the future or the past, which often causes anxiety. And a really good grounding strategy that I like and a lot of kids like is for older kids in this age range, the 5, 4, 3, 2, 1 method. So it's going through each of your senses. So 5 things that you hear, 4 things that you see, 3 things that you smell, 2 things you taste, and 1 thing that you touch. So, maybe noticing like the physical presence of your body on the chair, for example. And then for younger kids, this similar theory, but I call it like your senses high five. So they just have to notice 1 thing for each of their 5 different senses, but helping them come up with a game plan for what to do when they're noticing that anxiety and strategies to implement to help them to be able to calm down at school or in other extracurricular activities they're participating in.
Great. Thank you so much. I think one of the advantages that we have in situations like this is that for most kids, it's the same, right? It's not just, my kids were home for a year. It's everyone was for the most part. So as they're getting back to schools and these extracurricular activities, they're sort of all experiencing the same thing at the same time, which I think could also be helpful just from a peer support perspective. I'll tell a quick funny story. We took a trip to Disney during the summer, and my son, my 7-year-old, has a ton of fear around COVID. So I had forgotten the mask in the car. My wife was a couple of steps behind us, and we would not get on the boat until my son bought a mask, where I bought one that was $2 from a vending machine before we got on the ferry to go to Disney World. So can you talk a little bit more about kind of that fear that kids have around, what have we done to them by trying to get them to wear masks and continually wash their hands? Do you see any long-term effects of this, or do you think kids are so resilient that it was as easy as it came, it will go away eventually?
Yeah, I think you're right that there is that anxiety that many kids are having about, being out in the environment, doing things, going to Disney, going to school. One of the positives that I try and help talk with young kids about, and just any kids in general, and ourselves as adults too, is just trying to focus on what we can control. So thinking about the things that you are doing to keep yourself safe, the things that you can control. We can't always control if we have a potential exposure or who's around us, but we can control, like you said, if we wear a mask, if we wash our hands, the things that we can do to help keep ourselves safe. And by helping kids have that sense of control and feeling more kind of mastery around their environment, we can help decrease their anxiety. Helping kids to be able to identify if they're having lots of worry thoughts about COVID. I think that a lot of this, especially earlier on, I think many people have identified this as an issue and reduced media exposure. But I think early on, a lot of us might have had a lot of media on in the background. And I think that was really amplifying anxiety in our kids. I think a lot of us are reducing that, but that's something that I certainly recommend in the household to not have that constantly on, because I think that amplifies anxiety, well, frankly, in all of us, but especially in kids. So helping kids to be able to identify, well, what are some of those worry thoughts, and to be able to talk back to them, even, young 5-year-olds, I can do that with, where they can identify some of the things that they're worried about or some of the things that they don't want to happen. And then to be able to help them talk through, how can we talk back to that worry thought, or how can we, with older kids, kind of analyze the likelihood of that worry happening.
Great, thanks. And I know in my little one, it's always interesting to figure out how insightful and smart our kids are.
Yep.
It was really tough. Like I said, one of my 7-year-old, when we had to take him in to get tested, and he looked at me outside of the testing center at the hospital and said, "Dad, I wore my mask. I washed my hands. Like, why am I sick?" It's a really tough thing when they're doing what they're supposed to do, and you don't really have a good explanation behind it. Any coping mechanisms or ways to think or have those discussions with your kids when, let's say, they did everything right, but they ended up getting sick, whether it be COVID or another respiratory virus?
Yeah, absolutely. I mean, I think that one of the best things we can do is just validate the fact that it is really frustrating that they did like your son, he did everything. He was very vigilant about it, and yet it still happened. And so just validating that for them, recognizing and acknowledging that, yeah, we don't know how this happened. We don't know exactly, who you were exposed to or how you got the virus, which I think is true for a lot of kids when they do end up with COVID. And that's frustrating, and acknowledging that and giving them opportunities to be able to voice that, and not jump into problem solving mode or not minimize the frustration that they're experiencing, really just giving them space to be able to express that, and really opening that communication for them, and letting them know that it's good to talk about those feelings. It's good to express whatever they're feeling, and that you're happy that they're bringing it up and you want to talk about it with them.
Yeah, all I could do is give him a hug and tell him
Yeah.
that, he did everything right, and sometimes
Mhm.
things just happen as with many things in life. I think that's
Mhm.
an important life lesson.
Mhm.
The last question here, which is a really interesting one, is, let's say that somebody maybe had a 1-year-old right as the pandemic began in 2020, and it's now almost, a year, almost 2 years later. And that, child has been, they've been at home a lot with their loved ones or their family and maybe a limited subset of friends. Do you think there's going to be any kind of long-term impacts of them not going to birthday parties or not interacting socially at such an important time in their life?
I think that absolutely, if they were 100% completely alone. I mean, thankfully, we know that's not the case with kids, right? They're being supervised by somebody. So I think giving opportunities for that socialization that we can or that we're comfortable with, depending on the person's age, whether they're before school or before school age or during school age, but providing opportunities that we as parents are comfortable with for our kids to be able to build those social skills. I think that it is an interesting question. I think when we talk about social skills, that there really is that skill piece to it, right? So I know that some people had mentioned in their questions, like, for example, kids not going on errands with them, or like you said, the birthday parties. And, it kind of made me think, well, what are the aspects of going on errands that we want children to learn, even if we're still not comfortable maybe taking a child on errands? Okay, well, we want them to be responsible. We want them to learn how to, that they need to help out around the house, that they want to be involved within the family. And so, I mean, thinking about alternative ways that we can help build those skills. Um, Many kids, may have social skills deficits, not necessarily just related to COVID, but in general. And it really is something that can be worked on, and kids can make progress through working on social skills. So I think that even if, we do see some of those deficits, or like if you as a parent recognize that there may be some of that going on, that I think thinking about trying to work on those within the family, or, finding social skills groups or this sort of thing can be an
Great.
alternative way to work on those skills.
Yeah, and then hopefully during the last 18 months, people continue to do what they would normally do, celebrate birthdays, even though it was with a smaller group, continue to
Right.
live your life and do the things that we normally do every day. Well, thank you so much, Dr.
Yeah,
Williamson. I think those were all great techniques. We
good.
have an outstanding opportunity to, I think, learn from our kids, as we do every single day when you looked at how they interact. And, as they are learning what we're learning kind of all at the same time, I think a lot of the similar strategies that you mentioned for kids actually work great on adults
Yeah.
too.
Hmm.
So, really, really awesome insights. And thank you so much for sharing. So we have
Absolutely.
around about 12 minutes left in the session. We want to make sure that we get to the all important vaccination question. So back to Dr. Espinoza. I know we touched a little bit on it with our flu vaccine. Could you talk to us a little bit about when do you think the vaccine is going to be appropriate for our kids under 12? And kind of how do you see that going? How, or maybe some of the trials going? Are we seeing lots of side effects from the vaccine in kids?
Yes, Dr. Chang. So actually, we are doing one of those trials here in Tampa. It's with the Moderna vaccine. But today, the FDA received all the information from the Pfizer vaccine for the vaccine in children 5 and older, so 5 to 11. And we are all waiting for that data to be analyzed and hopefully to be approved. We really need that vaccine. And we expect that is going to happen hopefully by the either beginning of November or at some point between now and the beginning of December. I'm giving a lot of more space because recently the FDA is taking a little bit longer to approve these vaccines. And I know that they were requesting more children to be in the trial. But going back to your question about what we have seen in the trial, they enroll about 1,300 kids, and there were no cases of COVID, so the effectiveness seems to be great. And I decreased the dose of the shot. Actually, it's going to be like 1/3 of what we really get as adults. So the company is making a claim that by doing that, they were able to reduce the rate of adverse events. They did not see any really severe adverse events, and the other ones that they saw were really mild and pretty common among all the vaccines, right? Some kids will have redness, some kids will have pain at the site. Those are pretty common adverse events that we see with all the vaccines. So that data is very reassuring, and we are all looking forward for the approval of that vaccine.
Great, thank you. From just the idea of giving the vaccine to our kids and looking at some of the other medical conditions they may have, such as asthma or congenital heart disease or anyone with a food allergy, can you comment a little bit about, is this any different from other vaccines that we would potentially give to some of those populations of kids with those diseases?
Not really. I mean, the trials have not shown that we have to modify anything because of that. As a matter of fact, kids have had a lot less adverse events and reactions and allergies and many other things that we saw in adults. And obviously, adults have a lot of more medical conditions, right? Children are, for the most part, healthy. And so we expect that they are going to be able to tolerate these vaccines even better than what adults did.
Great. And I know we've talked about this on the adult side a lot, but can you quickly just describe how the main vaccines, maybe the Moderna and the Pfizer vaccine, just quickly how they work and how quickly is it out of your system and what does it cause your body to create that allows us to protect against getting infected?
Yeah, that's a great question because a lot of people, fear that these are called RNA vaccines, and we all know that the RNA is part of the genome, right? But in reality, what they are is studies have shown what is the part of the virus that the immune system responds to. That's the spike protein. So what these vaccines are is a piece of that, a piece of the blueprint to create that DNA, that piece of protein that is called the spike protein. And when we get the injection right here in the arm, right in the muscle, the mRNA, so the messenger RNA is going into those cells in the muscle. The people don't seem to realize this. The whole mRNA vaccine is really disintegrated in your system in about 3 or 4 hours. After that time, you don't have it anymore. But that blueprint is going into your own muscle cells and is making your own muscle cells to produce that protein that is going to be recognized as a foreign, and then your body is going to react to it and it's going to produce antibodies. Then whenever you see that virus, the real virus, and you see that, or your body sees that spike protein, then more antibodies are going to go and are going to attack it, and then they are going to control the infection. And so really the mRNA is not staying in your system for a long period of time. It really is a short period of time. And that's why, like, the community, the scientific community is not that concerned about long-term effects. The effects of any vaccine in general, just for any vaccine, are in about 2 weeks. And so whatever we are going to see in 2 weeks, that's probably what we are going to see. Now, obviously, people get confused because the FDA ask for 1 year, 2 year follow up, but that they don't recognize that that's what they do with any intervention, even a device or a drug, anything. That's what the time that they recommend follow up. But it's not because that vaccine is going to stay in your body for 2 or 3 years.
Got it. And I know we talked about MISC earlier. Is it even possible to get MISC from the vaccine? Have you seen any of that?
That is a really good question. No, I have not seen any reports of anybody seeing this complication, and I can tell the community that we are all looking for it, right? Because we believe the MISC is a complication of the immune system. It's the immune system producing a lot of antibodies, what creates that awful disease. But we don't think that it is possible with this vaccine. We had vaccinated, like 6 million already kids, or young, or older kids, and we have not seen that happening.
Great. Thank you so much. It's valuable information around vaccination and kind of what's coming up in the fall for our kids. The last question that I did kind of see some press on was, it's tough to get patients and kids into the clinic or wherever we're going to get vaccinated. With flu season approaching, is it possible to get both the flu vaccine and the dose of the COVID vaccine at the same time? Is that something that you would recommend, just so they don't miss one or the other?
Yeah, that's a really good question. So the American Academy of Pediatrics and the CDC have definitely said that the old recommendations, having a precaution when you're having the COVID vaccine, they don't apply anymore. That now the Pfizer vaccine, for example, is fully approved, and we know that there is no contraindication or any reaction if you give it with another vaccine. So I would recommend everybody just to get, if they are at the pediatric office and they can get both, just get both. There is no contraindication for that.
Great. And I know we only have a couple minutes left, but I wanted to touch really quickly, Doctor, on the specifics around treatment for some of the patients that you're seeing on the inpatient side. Are they working, and what sort of things are you using? And is there anything that we can do to help protect our kids, from nutrition or vitamins that would help?
Yes, so preventing, right? We only have found that it is very, very effective for prevention is first vaccination, second wear your masks, third wash your hands, and distancing from other people, right? Those are kind of the preventive measurements. Now, from the kids that have become sick, and actually adults too, we have seen that many of them have vitamin D deficiency. And vitamin D that acts in many of the, or has a role in many of the immunologic responses, and so we think that that has something to do with the fact that some kids get worse COVID than other ones. If kids are getting a good nutrition, then they shouldn't be deficient of vitamin D, but there are some that are, especially if they stay at home all the time, they don't get out and they don't get the sunlight. So if you are worried about that, I will suggest that you talk to your pediatrician or your child pediatrician and just have that taken care of. And in terms of treatment in the hospital, unfortunately, we don't have that much. And you know that this happens in the adult side too. But we have been using remdesivir, which is the only antiviral that is available. And but there are a lot of restrictions with it, right? If you're too sick, you cannot get it. If you are too far into the disease, it doesn't work. So there is a fine line when you actually can receive it, and it is a medication that is safe. We don't have a lot of data in children, but it seemed to be safe, and we are using it in those kids that are requiring increased oxygen supply. The other therapy that I want to mention is the monoclonal antibody. A lot of people may have seen in the TV or talking to your doctors. Well, kids can have it as long as they are 12 and older. So since this event is for talking about children that are 12 and younger, then they will not be able to get it. But if you think that your child has any immunocompromised condition that really put them at high risk for having a bad disease, please talk to your pediatrician or an infection diseases specialist, because you need to be aware of what all the possibilities can be. And then only support for the rest of them. MISC does have another set of medications that we use, and they are all immunomodulators. They are not antivirals, and it's a totally different treatment.
Great. Thank you so much. And I would really love to continue the conversation tonight, but I think we are at time. So I really want to give a huge thanks to Dr. Espinosa and Dr. Williamson for providing all their expert information on how we deal with COVID in our populations of 12 and under, our children in our community. It's an invaluable resource. And if you look at what we've covered on background information on COVID, the mental health aspects, testing, vaccination, treatments, prevention, lots of topics in a very short time period, but I really do appreciate everyone's attendance and all of your comments via Facebook Live. It's been an outstanding opportunity for me to bring this information out to you to better the health in our community, which is all we're trying to do to make a healthier tomorrow for everyone. So thank you again, and have a great night, everyone.